Member from Kitchener-Conestoga.
My question is for the Minister of Health. Speaker, we know as of today that there were 154 documented incidents where no ambulances were available for the residents of Waterloo Region. In fact, the Waterloo Region record has called this an ambulance crisis, but I call this a crisis in the Minister of Health's leadership. Once again, the Minister of Health has proven she cannot manage her own ministry and has put the lives of people in Waterloo Region at risk. Can the minister assure us that this problem does not rest in her ministry?
154. Minister of Health.
Speaker, I thank the member opposite for the question, and I think it's important to acknowledge that land ambulance services is under the responsibility of the municipality, Speaker. Having said that, we at the Ministry of Health do provide oversight. We also have made significant investments in ways to support ambulance services, Speaker. Ambulance offload nurses, for example, are being funded in our hospitals specifically to care for patients who have come in by ambulance, so that those ambulances and paramedics can get back on the road caring for patients. Speaker, we monitor response times and responses carefully, and we are always working with our municipal partners to improve ambulance services for the people of Ontario.
Thank you. Supplementary.
Again to the minister. Minister, you know full well that dispatch centres are under your control, as well as land ambulances. Don't pass the buck. Speaker, the same reports show that ambulances were unavailable up to 17 times a month since July 2010. Patients and paramedics in Kitchener-Waterloo have been forced to wait over 10 hours in the back of ambulances due to your colossal failure of leadership. Unacceptable. According to the Waterloo Region record, the figures released show the ministry has not been able to keep emergency wards operating in a manner to provide the timely service that patients expect. So I ask the minister, given that this was the situation more than 2 years ago, is she even aware that the situation has gotten worse?
Hand over your keys. Minister.
Well, Speaker, it occurs to me that this actually is a spend question coming from the opposition. They want us to spend more on ambulances. I understand that, Speaker, and I think the member's question actually demonstrates the importance of protecting spending on health care, and that includes the uploading of a significant portion of our land ambulance expenses. Now, I also understand, Speaker, that the party opposite would have cancelled our plan to continuing with the uploading of costs for land ambulance, and I think the question demonstrates the sheer folly that would have entailed, Speaker. So we will continue to work with municipalities. We continue to monitor issues related to ambulance offload times, response times, and so on. And I look forward to working with the member opposite to ensure that this community, in addition, has access to appropriate emergency service.
New question.